Hello, my name is Luigi Biel, student in Dr. Lolita's class for Infectious Disease Epidemiology, and today I'm here to discuss my outbreak investigation plan for yellow fever. On January 19, 2018, the CDC issued a Level 2 Enhanced Precaution Alert for individuals traveling to and from Brazil as there was an expansion to the yellow fever virus outbreak area. The target audience for this outbreak investigation applies to any public health professional or expert working for the U.S. Department of Health and Human Services. To summarize, an outbreak investigation for yellow fever is being conducted to ensure we are prepared for a potential infectious disease outbreak in the U.S., along with being able to accurately recognize and diagnose the disease in suspected cases. As the first human pathogenic virus proven to exist in 1927, yellow fever is a viral disease which belongs in the family Flaviviridae and genus Flavivirus with a high case fatality rate in endemic continents such as Africa and South America. Annual morbidity rates are at an approximate 200,000 cases, with 90% of them mostly in Africa, and a mortality rate at an approximate 50%. Signs and symptoms are different for everyone, though 55% of infected individuals go about their day-to-day lives without any clinical complication. For those who do experience a clinical episode, an incubation period of 3 to 6 days will pass, followed by an onset of flu-like symptoms which typically resolve within 1 week. Extreme cases develop viral hemorrhagic fevers, which consist of high fevers, jaundice, bleeding, and kidney damage, with 50% of patients dying from this. The epidemiologic triad for yellow fever consists of an agent, which is yellow fever virus, a vector, which is the mosquito Aedes aegypti, hosts being humans or primates, and lastly the environment, which may consist of the jungle, intermediate, or urban environments. The virus is transmitted in one of 3 cycles between humans and monkeys by mosquitoes. The urban cycle involves transmission between humans and urban mosquitoes and usually comes to an urban setting by humans infected in the jungle or intermediate environment. An intermediate cycle involves transmission between mosquitoes to humans or humans to humans via mosquitoes living or working in jungle border areas. Lastly, the jungle cycle involves transmission between non-human primates such as monkeys and mosquitoes found in the forest. With new epidemics occurring in South America, yellow fever is raising concerns over the mosquito Aedes aegypti as it is appearing in new geographic regions not found previously. With it, it carries yellow fever, Zika, and dengue viruses known as the vector for disease. This finding can lead to tremendous impacts on human health. Beginning with a healthcare provider, if a patient presents with a clinical manifestation of yellow fever, the healthcare provider should obtain a complete travel history from the patient to determine whether they went to any of the at-risk areas, obtain a blood sample for further analysis, and fill out a pertinent questionnaire to submit to the district-level authority. The district-level authority will then handle all lab work pertinent to the yellow fever virus. If results are positive, they have the ability to demonstrate that there is an incident rate of rare infection, which they will then immediately notify the CDC for additional support. The CDC will need to implement the NIMS measures to communicate with external agencies and the public to keep everyone up to date. The investigating team will need to interview the patient and obtain a complete list of individuals the patient has encountered to have them tested for yellow fever. Lastly, they will need to isolate all individuals with a possible exposure and wait for results. The public will strongly be urged to follow all preventive efforts to keep the outbreak in a confined area. Personal protection measures will include the use of mosquito repellent, wearing proper attire, and being aware of peak mosquito hours. Immunization recommendations will also be given to the public. In conclusion, the current trend of warming weather occurring on a global scale, government health officials need to be wary of letting their guard down as the morbidity rates rise in areas that never saw yellow fever. Immunization campaigns are extremely vital amongst those highest at risk to avoid all chances of an outbreak. Thank you for listening. Below is the list of provided references. Have a nice day.